Hello everyone, welcome to NG's Corner for Nurses. Hope all of you are doing well. Today we are here with the second part of the topic of oxygenation. Let's see the video. In this video, we will discuss about the terminologies which are related to oxygenation, then the sources of oxygen and the different methods of oxygenation with its advantages and disadvantages. Let's start with the term oxygenation. Oxygenation is the delivery of oxygen to the body tissues and cells. Then oxygen. Oxygen is a colorless, odorless, tasteless gas that is essential for the body to function properly and to survive. Next is oxygen therapy. Oxygen therapy is the administration of oxygen at a concentration of pressure greater than that found in the environmental atmosphere. The air that we breathe contains approximately 21% of oxygen. And oxygen therapy is a key treatment in respiratory care. We handle oxygen as a drug. Oxygen is a prescribed drug. There must be a written instruction by the doctor, and doctor must indicate the duration of oxygen therapy, the oxygen concentration and the flow rate. For administering oxygen to the patient in the hospital, there are mainly two sources of oxygen. First one is the portable source, that is the oxygen cylinder, and other one is the central source, that is oxygen wall outlet. And with both of this, there are a humidifier. The purpose of this humidifier is to humidify the oxygen. Otherwise, the dry oxygen can irritate the nasal or oral mucous membrane of the patient. Next, coming to the methods of oxygenation. First method is the nasal cannula or nasal prong. Through nasal cannula or nasal prong, we can deliver low flow oxygen, that is from 1 liter per minute to 6 liters per minute, and the percentage 24 to 44%. The priority nursing interventions for nursing cannula are: check frequently that both prongs are in patient nares. Check nares mucosa for dryness and be alert for skin breakdown over the ears and in nostrils. Next is simple mask. Through simple mask, we can deliver 6 to 10 liters per minute oxygen concentration, and that is 35% to 60%. Priority nursing interventions are: monitor patient frequently to check placement of the mask, support patient if claustrophobia is a concern. What is claustrophobia? It is a phobia related to closed place. And then seek your physician's order to replace mask with nasal cannula during mealtime. Next, coming to partial rebreather mask. The flow rate 6 to 15 liters per minute, that is 70% to 90%. Priority nursing interventions are: set flow rate so that mask remains 2/3 full during inspiration and keep reservoir bag free of twist or kinks. Next, coming to non-rebreather mask. Flow rate 6 to 15 liters per minute, that is 60 to 100%. Priority nursing interventions are: maintain flow rate so reservoir bag collapses only slightly during inspiration. Check that valves and rubber flaps are functioning properly, and monitor oxygen saturation with pulse oximeter. Next is the Venturi mask. It is a high flow mask. Flow rate 4 to 10 liters per minute, that is 24% to 55 or maybe 60%. Priority nursing interventions are requires careful monitoring and verify the mask valves, venturi mask valves, the color coded valves to verify the FiO2 at flow rate ordered and check that air intake valves are not blocked. Next, coming to an advanced equipment, that is the high flow nasal cannula or HFNC. It is a newer mode of delivering supplemental oxygen at a high flows, that is 40 to 60 liters per minute. A high flow nasal cannula is a heated and humidified system that allows prescribed fraction of inspired oxygen, that is the FiO2 levels, to be delivered at very high flow rates, that is 40 to 60 liters per minute. Next, coming to the methods used in case of pediatrics. In case of infants, oxygen hood is used. It is a rigid plastic dome that encloses on infant's head. It provides precise oxygen levels and high humidity. Hood should not rub against infant's face, neck, chin or shoulder. In case of children, oxygen tent is used. It is made up of rectangular clear plastic canopy with outlets that connect to an oxygen source. Flow rate is adjusted at 10 to 15 liters per minute. Next, coming to the advantages and disadvantages of different oxygen administering equipments. First is nasal cannula or nasal prongs. Advantages are client able to eat and talk with oxygen in place, easily used in home, safe and simple, easily tolerated and delivers low concentration. And the disadvantages are unable to use with nasal obstruction, drying to mucous membranes, so need to be humidified, can dislodge from nares easily, cause skin irritation or breakdown over ears or at the nares, and not good for mouth breathers. Next, advantages of face mask can provide increased delivery of oxygen for short period of time. Disadvantages are tight seal required to deliver higher concentration, difficult to keep mask in position over nose and mouth, potential for skin breakdown, and uncomfortable for patient while eating or talking. Advantages of partial rebreather mask. Client can inhale room air through openings in mask if oxygen supply is briefly interrupted. Disadvantages are requires tight seal, eating and talking difficult. Next, advantages of non-rebreather mask. Delivers the highest possible oxygen concentration suitable for patient breathing spontaneous with severe hypoxemia. And the disadvantages are impractical for long-term therapy. Malfunction can cause carbon dioxide buildup, suffocative, expensive and uncomfortable. Next, coming to the advantages of Venturi mask. Advantages are delivers most precise oxygen concentration and doesn't dry mucous membrane. And the disadvantages are uncomfortable and risk for skin irritation. Next, coming to the advantages of high flow nasal cannula. Heating and humidification of inhaled gas, high nasal inspiratory flow. Next is precise oxygen delivery. What is this precise oxygen delivery? It is when the high flow nasal cannula is used to deliver oxygen, the flow rates are much higher, that is 40 to 60 liters per minute, than can be achieved with traditional nasal cannula. Traditional nasal cannula can give 1 to 6 liters per minute. This results in a greater delivery of prescribed oxygen into the lungs and less entrainment of room air. Next is functional residual capacity enhancement. Despite the studies shows that the functional residual capacity increases by about 25% when the high flow nasal cannula is applied. Next is dead space washout. The high flow nasal cannula is applied. The constant high flow of oxygen provides a washout of the anatomical dead space of the oropharynx and the proximal tracheobronchial tree, which results in more efficient breathing. And the generation of positive airway pressure in the HFNC that results in increased end expiratory lung volume. Next part of the topic of oxygenation will coming soon. If this video is useful for you, then it is requested to put a like and share it with others. And for getting more videos like this, you can subscribe my YouTube channel or follow my Facebook page NG's Corner for Nurses. And for any queries or suggestions, you are most welcome to comment. Thank you for listening.